I'm Marge McDonald. Welcome to the inaugural episode of My Next Chapter, a show where we will explore the chapter after working and the 60-plus times of our lives. We'll cover everything from the serious to the lighthearted, so if you have an idea you'd like to see, let me know. Today's guest is Cindy Phillips, and she is the Shine Program Director for the state. So obviously we're going to be talking about Shine. Cindy received her master's in social work at the University of North Carolina, Chapel Hill. She has worked for the Shine, Serving the Health Insurance Needs of Everyone program, a SHIP counseling program for over 20 years in various capacities, and as the state director for the last 9 years. She serves on the National SHIP Steering Committee, the National Medicare Patrol Advisory, and Senior Care Options Advisory Boards in Massachusetts. Cindy is also a Burlington resident, volunteers with the Medical Reserve Board, and she is a town meeting member. Thank you for being here and being my guinea pig for the first show.
My pleasure.
So, can you explain to us what Shine is?
All right. First of all, I think as you mentioned, SHINE stands for Serving the Health Insurance Needs of Everyone on Medicare. So we'll see anyone who's 65 plus who has Medicare, or under 65 who may have disabilities and still be on Medicare.
Okay. So how does somebody access Shine?
Well, there are a couple of ways. You could either call 1-800-AGE-INFO or 1-800-243-4636, or call
The Council
the
on
Council
Aging.
on Aging in Burlington. It's been our objective to make sure that we have counselors in most towns in the state, and we have 1 or 2 in most towns. So usually you can call your town, or you can Google your town. You can look here at www.burlington.org and find contact information to the Council on Aging.
Great, thank you. So we have 3 volunteers at the Senior Center, and Brenda Pappas, one of our social workers, who's also a Shine counselor. Can you explain the process of becoming a Shine counselor for anyone who might be interested?
Sure. We have certain times of year when we conduct our training. It's generally after open enrollment, so it might be January through May. Generally, you would contact your regional office, or you could even contact your Council on Aging and then get information from the regional office, who would send out an application, complete the application, meet as a group with the regional director to determine, what your interest is, where you might like to work, if you can go through the training. Currently, the training is mostly face-to-face, and it's during the day, so we do have people who are still working who might be interested, but oftentimes don't have time for the training. So that's something to look at. We're also looking at some online training in the future, so we'll see how that fits.
Awesome.
And then generally, you go through the training, which could be up to 10 days and 5 hours a day.
Intense.
Recertification exam. Well, this is not a volunteer job where you're stuffing envelopes. It is intense. And people's health insurance depend on you. Whether they can get a good savings with the best drug plan, whether they can get a match up to other services. So it's kind of important.
Okay, thank you. So for those of you who are looking to volunteer, this could be an opportunity if you're looking to fill some large spaces. So going to the very, very beginning of the Shine program, can you tell us how Shine came to be?
Well, I could tell you that the Medicare, or Centers for Medicare and Medicaid Services, realized that Medicare was confusing to people. So they started a couple of pilot programs, and actually the one in Massachusetts started in 1993. I came on board in 1994. So, back then, Medicare was confusing, and now we've got a lot of Medicare Advantage plans, we've got Medicare drug plans, we've got programs to pay for Medicare drug plans, all sorts of variations that people didn't even have then. So you can imagine how confusing it might be now.
A lot of choices.
Right.
I've heard a lot of buzz about Shine losing its funding. What can you tell us about the future?
Well, I have a teeny crystal ball.
Okay.
And the future looks okay for now. Both the House and the Senate Appropriations Committees include funding for Shine. However, the current administration did not want to fund Shine. So, hopefully it will still pass and we'll have funding for 2019. 2020, again, is another situation that we don't know about. There are no guarantees. And it's difficult.
Are we talking federal or state level?
It's federal. It's all federal funding. Yeah.
So a little harder to advocate.
Right,
for.
right. And, we have some great reps and senators in this state, and they're generally very supportive. But it's, other states we need to reach out to, too.
So how many, does the whole country have these programs?
Every state has a program that's a SHIP program, but they might be called something different. Their choices, their high cap, their shine in Florida like their shine here. So in a way, there's a branding thing, that we aren't all known as the same program. Like Meals on Wheels, everybody knows what that is, right? But shine, not really.
Okay.
Yeah.
So it doesn't look like we're going to lose shine at this point.
It looks for, and again, it's a year-by-year basis, and a lot may depend on who is elected in November,
So is there anything that folks can do to help kind of keep it going as we come into new cycles?
One thing, we just had a conference in Chicago to talk about the program and the future of the program. And like with most programs, they want to hear about not only data, but stories. And we have a lot of stories. But if you have a story where you worked with a Shine counselor and you found it was a great experience, or you saved a lot of money, or you wanted to refer somebody else, we'd love to hear your story and be able to share it with our legislators.
Absolutely.
Yeah.
So if you have a story, let me know, and I will. I'll let Cindy
That'd be great.
give you your information so she can get in touch with you. So obviously, you don't work in a vacuum. You must work with other agencies that help with working with people with health insurance. Can you talk about some of that?
Sure. That really is the beautiful thing about being at the state level and across the street from the regional Medicare office. We had a case come up recently with somebody who was struggling to pay for their medications. So I was able to call the pharmacist with Medicare. She gave me a hint. I talked to the Mass College of Pharmacy pharmacist, and then come to find out the man was also a veteran who had not been in touch with his veterans agent. So between the three of us, or the four of us, we were able to find a couple of really good programs that the fellow could get into and save a lot of money. And, when it comes down to taking medication, chopping it in half, not taking the right kind, or not taking it at all, versus paying rent or something else, it's really important that we help them find the right thing.
You talked about people cutting their medications in
Yeah,
half.
yeah.
Do you have any other horror stories about people not, when they don't have enough insurance?
Oh, we have people not taking their insulin.
Ooh.
Yeah. Yeah, and insulin really jumped in cost last year. So, they maybe would have one injection a day or two a day, and they would cut down to one every other day, which is probably really hurting them in the long run. We have people that just will go to the pharmacy and be told what the new cost is for their prescriptions and leave them on the counter because they can't afford it. And it's understandable. They're so expensive. Drug plans can increase the cost almost any time, but there are programs they don't know about that might be helpful to them.
One of my passions has always been the folks in the 50 to 60 range who lost their jobs for whatever reason, going back a little bit, and then had no health insurance. And, that we get them in their 60s and they're frail and sick. And, so it's heartbreaking to hear people still doing that once they have Medicare.
That's right.
So the new Medicare card is in the process of being rolled out. Can you explain why the government is spending so much money to roll out new cards to everyone who's on Medicare?
Well, the government cares very much about fraud and abuse. In fact, have done ample studies to find that fraud and abuse has cost Medicare billions of dollars. And one of the reasons it's cost that much is that people have been able to get a hold of their Medicare cards, which has the Social Security number on it. So the main objective in issuing new cards for everyone was to give people a random number. It's not your Social Security number, you still have that, and you can still keep that card in your safe or wherever it's safest. But to give new Medicare card numbers to every single person who has Medicare. Yeah, to basically prevent fraud and abuse.
I still see people coming in with their Medicare cards that are kind of, all destroyed at the edges, and they're in their wallets, and they pull them out, and it's just scary in this day and age.
Right, and in fact, in Massachusetts, you can, they started to send them out after July 23rd, and I think that will go through the end of August. If people are worried because they didn't receive their card, they can set up an account with mymedicare.gov and check to find out where it is. Where's the process?
Okay, good.
It can be that they don't have the right address for you. So that's another reason some people wouldn't get their cards.
Do you need to have an account set up with Medicare?
No, you don't need to, but if you want to check, you can.
Okay, but do you have to set up an account to check to see where your card is online?
If you do it online, yeah.
Okay.
Yeah. Otherwise, you could call Medicare.
All right.
Yeah.
I would say to people, if you want to try and look online, if you come in, we can help you set up an account and see where that card is.
Great.
Don't fall for anyone calling you.
That's right.
Saying, we have your card, we're ready to send it out, but you have to send us so much money, or you have to give us this information. Don't fall for it. That's not going to happen. No one's going to call you and tell you that they have your card.
Correct.
Right? Okay. So besides what I just mentioned, are there any problems that are popping up with the rollout of the new cards?
I think it's primarily the fraud and abuse is the issue. Yeah.
Okay.
We have only seen 4 iterations of the rollout, so we'll wait to see what else is happening. But just about every state has said there have been people calling and trying to get their cards. Medicare tried to even protect the information by telling us generally when it would come out, rather than what week, so that people wouldn't get into mailboxes and take cards out. But I think some of that has happened.
I'm sure.
Yeah.
It also makes people worry about when their cards are coming.
Sure. Sure.
We've been hearing about it since April, and I'm hearing, where's my card? Where's my card?
Right. Yeah.
So fall is a busy time.
Yes.
For Shine counselors with open enrollment. Anyone over the age of 65 would know all about open enrollment, or should. Can you talk about it? Just tell us when it is and explain what it is exactly and the importance of open enrollment.
Sure. Well, Medicare prescription drug plan and Medicare Advantage plan open enrollment starts October 15th and goes through December 7th. This is the time when you can make a change to your plan, or you can purchase a plan if you don't have one already. Some people have Medicare and they decided to wait to add other benefits, so now they can do that during that time period. Medicare counselors, the Shine counselors, have been trained a long time on how to use the Medicare.gov website, the plan finder, to find different plans. And we could sit down with people and look at whether you want a prescription drug plan, whether you want a Medicare Advantage plan, look at your current plan, compare it to one that might be better for you starting January 2019, January 1st. Yeah, wow, 2019.
It's crazy.
I know. So we help people do that and, look at other things related to your plans, like your providers, like your drugs. Are your drug costs the same this year as next year under this new plan? Have the tiers changed? There's a lot to think about. And we do try to teach people how to do it themselves as well, since it's an annual occurrence. It's not like you could pick your plan and then it's good for 5 years.
Yep.
It really isn't.
What about these tiers you just talked about?
Yeah, tiers. There can be up to 5. There is your preferred generic, there's your regular generic, there's the brand name, preferred brand name, and then also the specialist medications, which are really, really expensive. Yeah. And, depending on which tier you're in, it could go up or down depending on the company you choose. That's how much it will cost. Yeah.
Okay. So the basic health insurance, the Medicare, actually, can you explain to us the differences between the Medicare A, the Medicare B, C, D, E, F, G?
Okay. Medicare A is generally the health insurance that covers you when you're in a facility, like a hospital, skilled nursing facility, home health, some pints of blood. Medicare B pays for providers, but 80% are providers, ambulance for outpatient physical therapy, rehab, and things like that, and other home health. Medicare C, because there are gaps in expenses. Medicare doesn't cover everything. Gaps in expenses with both A and B. Medicare C is what they call an umbrella type of plan that helps fill in those gaps and can offer a drug plan. Alternatively, people sometimes choose a Medigap plan. In Massachusetts, we also have Medigap plans, and they fill in the gaps also. But the drug plan has to be freestanding. So that's why we have freestanding drug plans, and we have Medicare Advantage plans that include prescriptions, and why we get a little confused.
Yeah. I don't even try. I just give it to you guys when someone comes in and asks. So for those who might consider tackling open enrollment by themselves, explain why they probably shouldn't.
Well,
Or should.
it's an interesting time of year. We have the Medicare health insurance plans are doing presentations. The SHINE program is doing presentations. So there's information that gets out there. You will receive a lot of mail. And in fact, there will be another special enrollment for Medicare Advantage plans next year in 2019, which is new. So you'll get a lot of mail, a lot of conflicting information. There might be new supplements added to the Medicare Advantage plans, like other benefits that you hadn't thought about. The thing about the Medicare open enrollment is it's a time to compare everything in a logical, unbiased way, and that's, I think, where SHINE really helps.
Yeah.
You know, it's not a sales pitch. Your information is completely private and confidential with us. But you could go on to the Medicare.gov website. In fact, a lot of people go on themselves. Like you mentioned, they go on, they come up with some choices. Then they might call us and say, gee, what do you think? We'll put in the prescriptions. They put in the prescriptions. You know, and we can compare what we've come up with. And then a lot of times they feel much more confident about, you know, the information. We also ask people about their finances. And if they want to give it to us, that's great, because there are plans that will help pay for prescription drugs and Medicare.
What about for people who are lower income?
For lower income, there are programs, the Extra Help program that helps pay for Part D. Sometimes it's the entire premium with very small co-payments. This is a great plan, and once you're in this Medicare, this Extra Help program, you can also be in the Medicare Savings Plan program, which pays your Medicare premium of $134 a month. So they work together, and you know, then that opens up access to maybe fuel assistance. It helps you think about other things that help you manage better at home, you know, to be able to pay those bills off, to keep you safe and warm, and you get your prescriptions, and then maybe you have a little bit of extra money to spend on your grandkids.
There you go.
You know,
It's all about the grandkids.
all good. It's, of course it is.
Can they access these programs themselves, or do they generally need help?
Yep. If you want to put in an application for Extra Help, that's to pay for your drug plan, you just go to www.socialsecurity.gov, and they have a button, you know, where you can sign up. It's pretty easy. In fact, we help people online do it, and then Social Security just checks your income levels, and that's an easy way to do it. Medicare Savings Plans. Well, if you want the full scope of access to health benefits, it's a Medicare or a Mass Health Plan application. You know, or there's also a little bit of a Medicare buy-in application. So there's 2 applications available at Mass Health.
Okay.
Yep.
But they can navigate. If they can navigate it, they can navigate themselves.
If they can, go for it. If not, or if you want a second
Call us.
opinion, call SHINE.
Can you talk a little bit about turning 64? Not that you're turning 64, but what you need to do when you turn. When you're 64 and you're looking down the pike at 65, whether you're retiring or not.
All right. Well, that's a really good question to ask, of course, because when you're 64, you know you've got that Medicare card looming in your near future. So people can actually sign up for Medicare around their 65th birthday. That's really the date to be aware of. You can sign up 3 months before, so it starts the first of your birthday month, hooray, or up to 3 months afterward. But the longer you delay, the longer it takes for you to get your card. And if you're still working, you could sign up for Medicare A while you're working, defer Part B. You don't need to pay for that and your health insurance, if it works best for you. And then when you retire, pick up Part B. We do find, though, that some people have been given a severance by their company. They're sort of laid off, but they're still under current coverage, so they have to be careful now about picking up Part A. Or if they have a health savings account and they've been contributing to it, they can no longer contribute. So there are these little nuances that poke their heads up now and then.
If they're on Medicare A and only Medicare A, they can't contribute?
Right.
Okay.
Because they look back 6 months, and you can't do both. Maybe they'll change that. They could change it.
And pigs will fly.
Yeah.
What about prescription programs for people who are still working and are still covered under their employee or employer?
Well, it's possible Prescription Advantage would help you pay for your prescriptions. Prescription Advantage was a state pharmacy program that's been around a long time and has changed a bit over time, but it will work with an employer plan. If people fall in the right income bracket and go into what's called the donut hole, which will be changing also.
What about with people who are still working, if they don't sign up for prescription insurance through Medicare when they turn 65, and then they decide 5 years down the line that they're going to, that they're finally going to sign up for that insurance?
Well, hopefully, while they've been employed and had drug coverage, it's been what they call creditable for Part D. Usually it is. And that means that when you turn 60, when you retire and you pick up your Part B, you also need to pick up Part D. And they give you a couple of months to do it in. You can take longer to get B, but you need to get Part D within 2 months. And hopefully you know all this.
Yeah, I know that when they started with with Medicare Part D, there was a lot of misknowledge, shall we say, and people weren't really getting the information, and there was some interesting things that happened as a result of that.
Well, I think part of the issue is that human resources in offices they're overwhelmed with what they have for their employees. And so they may or may not be able to tell people when they retire that you should be doing this or that. And currently, people are not notified when they're about to turn 65 that they should, watch out for the coverage. But, certainly when they leave their job, that can be a gap for them as well.
Yeah, it's always scary to be without health insurance, especially in a state where we're used to having it and we have good medical care.
Right.
And you just take it for granted.
Oh, I know. And then, you have enrollment periods for this and enrollment periods for that now, and it used to be more open. So you really have to pay attention to enrollment periods.
So what happens if you miss the open enrollment period?
Well, if you miss the Medicare open enrollment, they have a general enrollment January through the end of March every year. So you could sign up then. But in the meantime, if you haven't signed up when you should have, or if your plan was not creditable, you might get a penalty.
Okay.
It could be for Part B and or for Part D. And nobody likes penalties. The other thing about it is, even if you sign up during that period, it does not become effective till July 1st. I've seen people who've had to sign up during that period and wonder about their coverage in the meantime. And now that they have signed up for Medicare, they're not eligible to get the connector plan. So it can be a little bit hairy. Yeah.
So there's no connector type
There's
of
not a connector
insurance
in between necessarily. Although sometimes private plans will come up with something short term. So.
Yikes.
Minute clinics, yeah, it's too bad.
Hey, they're popping up everywhere. Urgent
They
care.
really are everywhere. I've seen them. Yeah.
Urgent care is always a cheaper alternative to the emergency room if you need urgent care.
Yep.
I had another question. I can't remember what that question was. So, do you have any stories for us, examples of people who have been helped by the Shine program?
Well, I did mention that one of the fellow we referred to, the VA and the pharmacist. Sometimes we'll have somebody come in who's been on a connector plan, and they go along thinking, I did the right thing. Massachusetts requires us to have health insurance. And sure, I turned 65, but nobody said anything to me. So, I didn't do anything. My premium's $86 a month. And then they find out later, when the connector looks back, it says, oh, you need to be on Medicare, that it's going to increase, maybe double, and there are other coverages that have to happen. So, we've been referred to a number of those folks and able to let them know that there's a special waiver program, equitable relief they can get into to help pay for that.
But once you're under penalty forever, correct?
Depends on your income. If you're lower income, they would absolve you of the penalty. Yeah, and sometimes, you're still working, so your income has counted that year, but then you retire and your income changes a lot. That's a good time to go back and let them know that, your income's changed and you need to get rid of that penalty or have some other kind of program.
Okay.
Yeah.
So going to retiring is not the only time you'll see a Shine counselor.
Almost any kind of transition time from one insurance to another, from work to Medicare, from connected to Medicare. People who have been on Mass Health are surprised to find out that the rules are tighter for people who are over 65. And that can be some bad news for people. All of a sudden they can only have $2,000 in the bank as opposed to whatever.
Yep.
So, that's the time to work with a Shine counselor too and see, what else can be done to make that health insurance more affordable.
What about dental care?
What about dental care? Well,
that's a problem lifelong.
It's another little, I was going to say Pandora's box, but it's not that bad. Some of the Medicare Advantage plans, allow for dental screenings and maybe an x-ray and a little bit of service. The Medigap plans can also offer a rider for some dental work. The other thing is that there is dental insurance that people can access through the Medicare, the MEMA Health Connector site, which anybody can use of any age. So there is more accessibility. People who are using the health safety net can get dental service at certain clinics. I don't even think there's one nearby, but that's another option. Yeah.
And the ever-present dentures. Do they cover dentures?
Dentures.
Not
Probably
sure.
not.
Okay.
Yeah. Or with the dental insurance, you, of course, could get coverage, but it will probably
Yeah.
pay for
And then hearing aids.
Hearing aids, again, it's a Medicare Advantage option that sometimes they'll pay X amount toward a hearing aid or every 2 years. Same with glasses and vision. You could have an eye exam and they'll maybe pay $100 or $2 per year, toward the eyeglasses. A lot of people like the Medicare Advantage plans because you can find them for zero premium and they might have these extra benefits as well as a physical, right? Yeah, the thing to be cautious about though is that while there are extra benefits, there might be costs associated with healthcare services.
You're willing to
So
think
it's a lot
about
to look
what's
at.
important to you and what you need out of your
It's a very
health insurance.
individual experience.
Just like we do now.
Yeah.
Well, it's like you do if you're under 65. So we're getting toward the end of the very first show. So thank you for coming and talking about Shine and Medicare and all that it entails. Any last words of wisdom before we
Well, I guess the last couple things I'd like to mention is that the Shine Regional Office is at Minuteman Senior Services down the road in Bedford.
Yep.
And there are also Shine counselors at Leahy Clinic and available at Minuteman. So, they're out there. We try to be accessible and available. Call us if you have a question.
Yep. And Brenda Pappas, our social worker, is also a Shine counselor, pretty much reserved for people who need home visits, as the volunteers won't do that. So, again, thank you for coming out and doing this for me.
We love the Council on Aging.
Thank you.
Go to the Council on Aging.
You need the Council on Aging for socialization. We have lots going on.
Right. Great programs.
If you have any ideas that you'd like to see us cover on my next chapter, please let me know at mmcdonald@burlington.org or give me a call, 781-270-1953, and we'll see what we can do about putting your ideas on. Thank you very much. I'm Marge McDonald, and this is my next chapter.